Thanks, everyone, for coming this morning. Before I start my little number here, I wanted to offer one observation. I was here yesterday and attended some of the meetings and was struck, I think much like Roger was struck by a sense of global health being over there, and that perhaps aiding and abetting some of the communications issues that were brought up yesterday. But the over-there-ness that people talk constantly about trying to inspire students, etc., by sending them to Peru, to Uganda, to India. And it struck me that as a total novice, I have no global health credential or experience except in doing the projects I do locally. But it struck me that global health really is over here as well. The center I manage does projects all the time about communities that are immigrant communities from other places, with other cultures, with other expectations, with other attitudes toward health and improvement. And I think that, so what I'm saying is you step outside your door, and I'm sure it's the case for many of you as well, you step outside your door and you are in the global health environment. That's just my observation. Now, back to the center and new media partnerships. The panels yesterday gave me all kinds of grist for the mill. A panelist at one of yesterday's plenaries admonished the audience, quote, not to believe everything you read in the papers, unquote. Well, let me ask you this. What if you didn't read anything in the papers? What if you read nothing about medical issues and nothing about HIV/AIDS and nothing about possible new pertussis outbreak or issues swirling around the new health reform in this country, or about global health issues, other global health issues? What if you read nothing about them? What if you read nothing about these things because there was no one to report on them? Well, that was one question among several that led to the founding of the Center for Health Reporting, where I've now managed about a dozen in-depth projects over the past 2 years on California healthcare issues. The center, Roger said it earlier, the center has among the world's longest, I should say, formal names. It's the California Healthcare Foundation Center for Health Reporting at the Annenberg School for Communication and Journalism at the University of Southern California. That pretty much fills out my card when I give it out. There's no room for anything else, my name. But what we do find from this is it's a collaboration between two very large institutions. One of them is the California Healthcare Foundation, which most people, I didn't know about until I got into this. It's a $1 billion foundation, nonpartisan, nonprofit, that it's based in Oakland, and it funds research into health policy issues and questions affecting Californians. That's an awful lot of stuff. And the other half of that equation is the USC School of Journalism. So you've got two very large institutions that have come together to form this Center for Health Reporting. The relationship boils down to this. The foundation, the California Healthcare Foundation, brings us both the funding and access to expertise. They have a number of people on their own staff who are experts in different fields of healthcare, and they know everyone in the country, dare say, who is an expert on healthcare delivery and healthcare policy in the United States. So they give us that. And then the University of California, of course, gives us the journalistic expertise that we need to carry on this task. Now, that's partnership number one. Partnership number two takes a short backstory, and the backstory is this. The foundation was rolling right along, funding this, funding that, very significant policy research issues from the experts in the field. But one day it was sitting around the table at its board, and it said, who's reading this stuff? And they concluded that it was a universe of about 40 people who were reading all this material. And they hoped and planned to expand the dialogue, a greater audience especially. They really wanted the public involved in these vexing issues of health care. So they thought about how they could do that, and what came up was one word, journalism. Can journalism help us do this? Well, let's find out. So they funded a pilot project that I headed, and the project's basis was to go out to small and medium newspapers in the state of California and to offer to partner with them, this is partnership number 2, partner with them on health care policy issues that they wanted to tell but had no capacity to tell. So one of our goals was to increase the capacity of these small and medium-sized papers to tell their health care policy stories. These stories are largely intensely local. There are stories that local papers that are 30,000, 50,000, 100,000 in circulation want to tell for their readers. They want to inform their readers about an issue. But most, if not all, of these issues have larger, broader implications. And we're still grappling with how to broaden out stories that we tell for these local markets. A story for one market about the duress on children, the anxiety and mental issues for children of the Great Recession can be told in any town in this country. We told it in one town this past weekend. There are a lot of issues like that. So we went out, we did the pilot project. The project was judged to be a success, and the foundation arranged with USC to fund us. The foundation did the funding. USC is our home for 3 years. And who is us? Us is a staff of 7, including 6 journalists and an office manager. We have 3 experienced journalists, one from USA Today, one from the Los Angeles Times, and one AP national correspondent who we convinced to come our way. And they have all produced just wonderful, wonderful stories that have had impact. That's what we're looking for, is impact, and we have had it. Now, let's go back to my original question about newspapers and health reporting. There was never an overabundance of health reporting at newspapers. You have to understand that to start. But with the combination of the Great Recession and the revolution, the internet revolution in information access, newspapers have been reeling, and as a result of that reeling, they have been cutting staff. And a number of important areas that traditionally readers depended on to be covered by newspapers have gone by the wayside. We call them beats that have disappeared. And the healthcare coverage beat is near the front of the line. So when I visit newsrooms all over the state, and I do that, I visit several newsrooms a month of small and medium and large papers, desks and even rooms are bare. They're gone. They're empty. And in all too many of these, there is no longer a healthcare reporter at all. There is no one covering health for that community. And in other papers, there may be a health reporter designated to cover health care, and that reporter is also designated to cover city hall, education, and transportation. So the focus on the coverage has suffered egregiously in the last several years, but it really goes back about 5 years since the internet revolution started smacking newspapers in the face. When I come to the editors of these papers and offer our help, they are, you can imagine, intensely eager to partner up with us. One question each of them asks is, what is your agenda? And I tell them, and I tell you, that the agenda of the center is to tell stories. The foundation that funds us has put no limits on what we can investigate, what we can write about. They have not told us on an issue that they're intensely involved in. They've not told us who to talk to or what to do or what to conclude. One series that we did, I got a call from the communications director at the foundation, and he said, "Great series, wrong result." I said, "What do you mean?" He said, "This isn't what we think should be the case, should be your conclusion at all." But he said, "We'll never tell you that until after the thing is published." So we are absolutely free to do what we must do, which is report out stories on a local level for various newspapers in great need. For any newspaper we work with, we are willing to provide a reporter, a project editor, a photojournalist, a videographer, a graphic artist, a multimedia journalist, whatever it takes to get that project done. And in a number of cases, it takes all of those things. Newsrooms don't have graphic artists anymore at these small papers. They don't have no database capability. So we're filling in the gaps to increase their capacity to tell important stories for their communities. We normally go into a room, talk to the editors, agree on a project. Frequently, it's a project they want to do that they've thought about but didn't have the ability to do. Sometimes it's a project that we bring to them that they go, hey, that's a good idea, let's go. But one way or another, we all get involved. We inhabit that newsroom for 4 to 6 weeks to tell that story. One part of our credo, the center's credo, is to do solutions-based journalism. I say that because journalism has been roundly criticized for presenting an almost totally negative picture of the world. Only bad things happen, then we report them out, and only bad things we go in depth and find out how bad they really are. Well, we talk about those things too. But the last piece we do is, so what can be done to affect that? And frequently, it's not all that satisfying, especially in the middle of a Great Recession. But there are little lights in the tunnel, and it's our job to find them and to show the readers that there are ways to ameliorate circumstances. So what kinds of stories have we done? We did a story in Merced, a small, fairly small city of about 70,000 in the middle of the Central Valley in California, the agricultural breadbasket of the country. We produced a 3-part series on the attempt by a new UC campus based there, UC Merced, to gain a medical school after only a few years in existence. And they made their pitch by saying this is among the most underserved populations, not only in the state but in the country. And we need a medical school, we need the products of a medical school to serve that population, many of whom are migrant workers, migrant farm workers. In Santa Cruz, we also did a story about that affected migrant workers, in this case, undocumented children of migrant workers who did not have insurance, and it was about a program to try to get them insurance. In Chico, we did a story about wood stove burning pollution, the smoke from wood stoves and the effects it has on people's health. So now that I have less than 2 minutes, let me simply say that we're one of a number of efforts that are trying to do this new kind of partnership. Among them, there's our sister foundation, the California Endowment, is providing money to hire health reporters at different small papers. The Center for Investigative Reporting out of San Francisco last year launched CUGH, which investigates health issues among other issues and offers those stories to papers to localize. They do a top-down approach, we do a bottom-up approach. ProPublica, some of you may have heard of, is a national effort to do the same sort of thing, in-depth investigative reporting on issues, including health issues. Okay, last thing. We have found that the best way to communicate health policy issues is not to issue reports or policy briefs, but to tell stories, to involve reader in people's lives, people who live down the street or across town. It's a very old formula. We didn't discover it. It's as old as Homer and as the storytellers in all the ancient civilizations, but it works, and it continues to inform and it continues to inspire. And I would urge all of you to think about storytelling as a major component of your work to spread the story of global health. Thank you.